Welcome, everyone, to the Dr. Abs Healthcast. I'm your host, Dr. Brian Abasolo, aka Dr. Abs. And on today's show, we have Dr. Michael Haley, who is a gut healing expert. Now, Dr. Haley is a passionate chiropractor and health coach. He emphasizes a healthy lifestyle and nutrient-dense diet as a means to achieve optimal well-being. His health principles are based on science, tradition, and in line with the scriptures. Dr. Haley owns and operates Stockton Aloe One, makers and distributors of 100% pure raw aloe vera gel health drink and aloe vera personal care products. He also maintains his private practice as owner and physician at Agape Chiropractic in Pompano Beach, Florida. He's an expert on phytonutrition and superfoods. He graduated from the University of Tampa and went on to Life College of Chiropractic, where he earned his doctorate in 1995. He is known by his colleagues as Organic Mike for his teachings in the area of organic chemistry and nutrition. I can't wait to talk all things health with Dr. Haley, so let's bring on Dr. Michael Haley. Welcome to the show, Dr. Haley. How you doing today?
I'm doing awesome. Dr. Abs, thanks for having me on your show.
Appreciate it. Love the king of the jungle in the background. Love that.
Yeah, I like the lion because the lion just could be so gentle and at the same time every now and then has to roar. And I would say most men can relate to that.
Yes, absolutely. Could definitely rip your head off on occasion as well. Yeah. So Doc, I want to dive right in. You are what we call a GAPS practitioner, which stands for gut and psychology syndrome or physiology syndrome. So just for the audience out there, what exactly is that and how do you help people?
Dr. Natasha Campbell McBride, a medical doctor, wrote some books about how she helped her child recover from, mental, emotional problems, possibly related to getting a vaccine, possibly related to some major change in life that affected her child's gut. And she restored her child's gut through diet, literally curing her child of autism.
Really?
By changing
that's a controversial topic, but I want to hear more.
Yeah, we don't know what causes these things, but if you think about it, something in life that can throw off the gut flora, cause your inflammatory bowel conditions, and there are so many names of them, whether it's acid reflux, GERD, gastritis, colitis, celiac disease, inflammatory bowel disease, inflammatory bowel syndrome. There's a gazillion names for these inflammatory gut conditions, somewhere between the mouth and the anus, causing things that you eat to probably pass through that digestive barrier, end up in your bloodstream, creating all kinds of autoimmune problems. And yes, it affects the way your body reacts and the way your mind thinks. And the quickest connection I could make is, if you and I went out for a couple beers, we can probably guzzle that first one and within seconds feel it. Changes that happen to us, to our chemistry, through our gut, through our digestion, affects the way our brain works. And it's the same way when it's related to the foods we eat and to our microflora. It's funny. I like the fact that I have you here where I can actually talk on a more of a doctor level. We think of illnesses like consider pertussis. It's a bacterial infection because our gut's loaded with bacteria. And we can actually take antibiotics to kill off that infection. But once that infection is symptomatic, even though you've killed it off, the symptoms can remain for weeks and even months, where people have that persistent chronic cough because the toxins that are released by the bacteria. And it's the same way when we get our flora in our guts off balance and they start producing chemicals that affect the way our body works and affect the way our mind thinks. So the gut and psychology syndrome is about eating right to heal your gut so that your mind works and better. And for other people, it's the physiology syndrome, people that have autoimmune pain syndromes, whether it's, chronic fatigue or fibromyalgia or a whole host of, arthritic, painful conditions that are autoimmune related to probably the gut leaking, causing the immune system to go haywire.
Yeah. Yeah.
So, yeah, I mean, that can cause any pain,
Yeah. And you talk about
illness.
antibiotics. You talk about antibiotics, how, yeah, they may kill the bacteria, but then they, you were talking about them releasing toxins, but they also kill the good bacteria in our gut, which, like you said, causes that imbalance. Now, we're speaking about a very special topic to me because I actually take this, or I have taken this fairly regularly, off and on, I would say, for the last year or so. But aloe vera, the benefits of aloe vera and its effect on various health conditions. And I know you discuss the benefits of aloe vera for things like, listen up, people, because I mean, you may be experiencing this: Crohn's, irritable bowel syndrome, GERD, diabetes, immune system disorders, eczema, psoriasis, dermatitis, vaginal yeast infections, shingles, acne, and so many other ailments. So, I want to hear from a gut expert like yourself, like, what are the benefits of aloe vera and how can they help the conditions that I just mentioned?
Yeah, a lot of people think about it as something that you put on your skin to help heal a burn. And yes, we know that it accelerates healing, probably by bringing blood flow to it. I don't know, there's a host of possibilities of how it accelerates healing, but that's the most common belief, that it somehow increases the circulation of the area. Well, a sunburn is very similar to ulcerated intestines. And they're both almost the same organ. They really are the same organ. Both the skin and the gut are this epithelial tissue, which is a specialized tissue that's good at absorbing and excreting. It's almost like our skin is a huge organ on the outside of our body, but it kind of folds through our mouth and makes this tube connecting our mouth to our anus. And if you think about it, our bodies are almost like those squish bags that you can put on your finger and just kind of, roll around, and you stick your finger all the way through it. What makes us different is we have this skeletal structure that stops us from rolling end on end. Yeah. But in a sense, that tube going through the center of our body, that epithelial tissue, when something is in that tube, it's still kind of outside of the body, just like if you were to stick your finger through that little squish bag. It's going through the middle of it, but it's not on the other side of that layer. It's dry. It's still dry. It's not in the jelly stuff on the inside. Yeah. Well, when we put things in our gut, it has to pass through that digestive barrier to get into our bodies. So if we think of our skin and our gut as really the same organ, then it kind of makes sense that, well, all the things you named, a lot of the skin conditions are really gut conditions, just being revealed on the part that we can see. Gotcha. So really, if the aloe can help the skin on the outside, why can't it help the skin on the inside and help heal not the sunburn, but a similar kind of ulceration, which we might call ulcerative colitis or inflammatory bowel condition? It's a inflamed, more red tissue than we'd otherwise expect, and it needs healing. So aloe is a wonderful thing at helping speed up that healing process. But as you know, the way the body works, when you consume something, it doesn't just touch that tissue on the inside. It eventually absorbs and travels to all the tissues of your body. So I believe the best way to heal your skin conditions, your eczema, psoriasis, lichen planus, so, whether it's autoimmune or not, is to heal your gut. And you will see it on the outside as what you eat travels to all the tissues of your body and works from the inside out. To me, a much wiser approach at helping skin conditions that you can see. And trust me, if you have skin conditions, you have inflammatory gut conditions.
Healthy on the inside means healthy on the outside. I couldn't agree with you more, Doc. So let's break this down, because I know from me taking it, I know there's different types of aloe, right? There's the whole leaf version, there's the inner fillet, there's the gel, there's the juice. Which one are you specifically talking about as far as correcting these gut issues?
Let me tell you with a patient story instead. That'll make more sense.
I was gonna add, that was my next question. Like, what results have you seen in the office with your patients with aloe?
Well, this was a case where my office manager, my front office manager, I just hired her. She was there for her second day. Actually, I hired her away from my chiropractor that I grew up with, but he retired, so it was okay. So she already knew how to run a chiropractic office. She was awesome. But her second day on the job, she said, "Oh, Dr. Haley, I just found out I have cancer again."
Oh no, sorry to hear
and
that.
I know, but I said, "Don't worry, we're gonna, get you all fixed up and stuff. This will be nothing to you. I want you to start drinking aloe vera." And I gave her 2 bottles of this frozen aloe, and I told her I wanted her drinking 3 glasses a day. Now, this is going to answer your question about the different kinds, and kind of in a humorous way. 3 glasses of aloe is a whole bunch of aloe, especially if you have the wrong kind. Well, she's going to commit to 3 glasses a day. And the next day she comes to work, and she spent probably the greater part of the day in the bathroom. Well, I found that a little strange, didn't say anything, but the next day she came back to work and she was again in the bathroom just all day long. And at the end of the day, she couldn't bear it anymore. She had to ask me. She said, "Dr. Haley, is it possible the aloe runs right through you?" I said, "No, not a chance." I said, "Well, not what I gave you." I said, "If you got your aloe from Whole Foods, sure, but not what I gave you." She said, "Oh." I said, "What do you mean, oh?" She said, "Well, before drinking what you gave me, I thought I would drink my husband's. He drinks it for his diabetes." I said, "Oh." Yeah, and nothing wrong with the aloe from Whole Foods, but the most common brand is a whole leaf aloe vera. So we're answering your question now. It was whole leaf. What does that mean? That means it has the outer leaf parts also, which some people prefer to consume whole leaf because they want to use it for its laxative effect.
Ah, gotcha. Okay.
See, the inner part is the healing part, the part that's good for the immune system, that increases your tumor necrosis factor, interferons, interleukins, and things that would help your body fight cancer, whether you choose to do medicine or not. We want to eat foods that helps our body fight cancers, especially when you're diagnosed with cancer, which is why I recommended it to her. But I gave her the inner gel, and I said, "How much were you drinking?" Because I recommended 3 cups a day. So I couldn't do 3 cups. I said, "Thank God, because 3 could have killed you." Just completely sucking everything out of you and deleting all your electrolyte minerals, dehydrating you.
Super laxative.
Oh my goodness. So those are the 2 different kinds of aloe. Inner leaf is the good part. Now, I have another patient story I have to tell you since I started.
Let's do it.
And I told you that some people use it for the laxative benefit. Well, I don't think that's the best way to treat constipation. Meaning, yeah, we're going to look at your diet and we're going to, are you chewing your food, working in all your salivary enzymes? Are you getting a, good spectrum of the right kind of foods that work for you? Do you have enough fiber in your diet? And if you do have enough fiber, you're drinking enough water, which is going to bulk it up and not only feed your intestinal flora, but help stimulate peristalsis and stuff like that. Do you have enough fat in your diet? That might provide a little lubrication. Do you need to take digestive enzymes, or do you need probiotics, or maybe some cultured foods? So we're going to look at the diet. But I remember this time, Charlie comes into my office, and Charlie was about a 30-year-old man. And I remember he had back pain that started that day, radiating down his leg to his feet, and he had neck pain radiating down his arm to his fingers. And I remember, focusing on the back pain because that was his major complaint. He could barely walk, kind of thing. And I took this X-ray, and I remember I'm pretty sure it was his L2. I don't remember exactly which level, but it was in that area, and it just kind of looked crooked and stuck and swollen. And it wasn't like such a hot disc that I couldn't do anything as a chiropractor. In fact, I was determined to fix it in one visit. I was brand new. And that's how we are when we get out of school. We think I can fix this in one shot.
Of course. Yeah.
And I remember, doing a little trigger point work and stuff. We're going back like, I don't know, 1995 or so. And I remember setting him up in that side posture position. Anyone that's been to a chiropractor, sometimes, we move bones manually and you hear all kinds of noises. Well, I put, my pisiform, the bone that we use for adjusting, on that thing and twisted him up like a pretzel in a sense and just laid into it. And it sounded like sitting on a bag of Doritos. I mean, you just heard all kinds of noises. Now, that was my first time ever seeing him. I don't even know. I was a new chiropractor, probably didn't have the best bedside manners. And I don't even know if I asked him if he had ever been to a chiropractor. What I do remember was the look on his face. And if you've seen the movie Caddyshack, you've seen this look, okay? Rodney Dangerfield's driving this huge boat, wide open yacht. And there's this black guy on this little canoe fishing all by himself. And he kind of glances and looks over, sees the boat coming, doesn't quite process it, goes back to fishing. And then he thinks, what the heck? And he turns again and his eyes get about as big as donuts as he realizes he's about to be run over. So he dives in the water to escape. That look on his face when he realized that Rodney Dangerfield yacht was coming full speed at him, the eyes that big, that was Charlie's look on his face when I had laid into that L2. I'm going to call it L2. I'm pretty sure that's the one it was, and just moved everything. And because of that look on his face, and I was so new, I remember, saying something like, don't worry, Charlie, that's exactly what I expected. I think I ran outside the room, got on my knees and said, God, what happened? Please help him. But he came back the next day for his follow-up visit, and his words went something like this. He said, Dr. Haley, something you did. I said, okay, what's going on? He said, well, I don't have any more back pain running down my leg. I don't have any more neck pain running down my arm. I did adjust his neck too.
Okay.
Something you did. I said, okay, what's going on? He said, first thing he said was, I can have sex again. I said, okay.
That's important.
You didn't, I got a box for that. You didn't check anything off here. He said, well, I didn't think that could have anything to do with chiropractic. I just had pain. I was just here to get out of pain. All right. But something you did, what's going on? And Charlie, what was that look on your face? He said, I don't have constipation anymore. And I said,
I was going to ask you, I was like, did his eyes bug open because he had to go to the bathroom immediately after the adjustment? Like, what was going on there?
You nailed it. I said, so what was that look on your face? He said, I had to go to the bathroom. And it was like 10 years of being, how long have you had these problems? 10 years of being backed up, released just like that in an instant. Now, those of you listening, it's not always like that. As chiropractors, we love to see that. We love when we can do the Jesus thing and raise the dead. And it's like, wow, but it's not always that. Some people have their problems longer and they're more difficult. And it takes some work to restore function. But every now and then, like with Charlie, we get to see that miraculous instant, healing. And it was a beautiful thing. But the point being is, for someone with a gut problem like constipation, yes, you're going to check the diet. And, we want to check your, how's your thought processes? What kind of chemistry are you creating with your mind? Are you getting sleep? Is your spine, decompressed and functioning so that the nerves that are coming down from your brain going to all the organs, are they being interfered with? Because a pinched nerve, just like it caused pain and numbness in Charlie, can also be going to organs and responsible for things like peristalsis, which is that muscle contraction to get the bowels moving like they're supposed to.
100%. Yep.
I didn't change his diet. I moved a bone. And it turned everything on.
Turned it on, baby. Turn the power on, as I like to say, as chiros like to say. That's amazing, Doc. That's amazing. And so Was he prescribed aloe after the fact?
You know, it's funny. I was being introduced to aloe vera back in those days by one of my patients, Rodney Stockton. And Rodney Stockton was this, well, at the time he was probably 80 or 89 years old or something like that. And he would bring these jugs of aloe, tell me I had to put all my patients on it, especially if they had cancer. You know, cures cancer, he would say, you know, which you can't say that anymore, of course. But he didn't care because, you know, he lived his full life and that's how he felt about it. Well, years later, now back in, it was about, let me see, 2010, Rodney had died. He was 96 years old at the time and he had a heart attack and he was done. His aloe vera product was a small South Florida thing. And I had my first cancer patient on the aloe, and she had stage 4 pancreatic cancer. And in her case, I, you know, got her growing sprouts and juicing wheatgrass and juicing fruits and vegetables and drinking 3 glasses of aloe a day, took away all the foods that she loved, told her you're going to feel like you're starving in a few weeks and that you're dying. But if you give it a couple more weeks, you're going to start feeling great and have more energy than ever before. 3 weeks later, I feel like I'm dying. You know, remember I said this would happen, and I give it a couple more weeks. Sure enough, a couple of weeks later, I'm feeling amazing. I have more energy than ever before. You know, I feel like I'm cured, kind of thing. Well, she went back and to the doctors, got some scans about 4 months into it. And they said, you know, now you only have these 2 little tumors. We can actually do surgery now. Initially, it was too much cancer, couldn't. So at that point, she decided to combine her natural nutritional therapy. And, you know, I call it nutritional therapy, not chemotherapy. But she decided to combine that with the medical approach. So she got the surgeries, and then after the surgery, they said, of course, you need chemotherapy after the surgery. So she decided to do that. But, you know, okay, as long as you continue to remember how you got here, you know, changing your lifestyle, your diet, and all these things that you're doing. So she pressed on, and that was about 12, 13 years ago, and she's still cancer-free today.
Amazing.
So, yeah, from stage 4 pancreatic cancer, which was the worst.
And that particular cancer is like, there's no return from that usually. So that's incredible. That's incredible.
Yeah, I think that one, is actually unique as we look at the pancreas and said, well, the pancreas is there to kind of like mop up the extra, you know, sugar in our blood, if I were to oversimplify it. So really what we did with her diet is we addressed sugar issues by taking them all away, putting her on a real food, you know, things that grow on trees and grow on the ground and stuff, which is a very, not necessarily strength and survival of the fittest diet. It's more of a cleansing detox, you know, anti-cancer diet. And so we put her in that direction. Oh, there's a reason why I was bringing this up with her. Why did we do that? Well, I will just say she stuck with it, and obviously it did what she needed to do. It's not the gut healing diet I would go with. It was an anti-cancer diet. Gut healing, I might even include some animal foods and maybe some bone stock and things like that. But it was the diet that she needed at the time, and it worked.
So the question about the back to the aloe, doc. So the inner fillet, like for everybody out there, that's the one you want to get when it comes to the more healing with the gut and all that. What are the brands? Like, obviously, I want you to highlight your brand. I mean, are all of them the same? I mean, I know we're going to get into organic right now. The word organic, like, is buying organic really worth it? Can you talk a little bit about your aloe and the? Yeah, I guess
most of my diet is organic. Our aloe, although it's organic, it's not certified organic because it's already expensive enough. Now, I'm going to tell you about 2 brands.
Okay.
And I'll say that these are the most contrasting brands that there are.
Okay.
And it doesn't make either one of them better than the other. It makes them different, but you'll understand a lot about ours and what makes us so different compared to other brands.
Okay.
And the one that I like to compare it to is George's, because I believe that is on the exact opposite end of the spectrum. It doesn't mean that it isn't good. It does mean it costs a lot less and it has a much longer shelf life. and there's a lot less aloe in it. It's the most filtered. It's so filtered that it doesn't need preservatives and it can last forever. In fact, if you buy a bottle of it and you shake it, it'll sound like water.
Okay.
Now, so it's so filtered, you won't even be able to taste the difference. It'll taste like water.
Okay.
I remember telling my wife that, and she didn't believe me. I bought her a bottle one time, and I remember when she drank, she said, "Wow, you weren't kidding." I mean, I cannot tell the difference. Now, there's a lot of people that love Georges and swear by it and say, "Wow, since I've been drinking Georges, I've been doing great." What's the opposite of that? Well, if you hand fillet a leaf, cut the ends off, bleed it out to get out the sap out of the leaf because we don't want to contaminate it. Most brands use carbon and diatomaceous earth to filter out the outer leaf parts. By bleeding it out, we can let it bleed out as much as possible, then rinse the leaf and then finish filleting it and just get the gel out without getting that sap all over it. So we don't have to mix it in diatomaceous earth and activated carbon. They essentially run it through a grinder, and most brands at that point will pasteurize, add the ingredients, put it through a pressure filter, and what comes out is this clear liquid, very thin. Some brands will add things like carrageenan in it, and you'll see it is listed as a thickening agent because they want to make it look more like aloe vera. Ours is not like that. It doesn't go through those processes. It's just hand filleted, run through a grinder, which makes it something you can drink. It's very thick. When you shake it, it's goopy. The only way to keep it that way is to put it in the freezer. So it's raw, frozen aloe vera gel from the inside of the plant. Obviously, we're the most expensive because it has to be kept frozen. That drives up the costs. It's very perishable. It can spoil if it doesn't get to you on time. We ship it frozen. We have to use fast shipping to get it to you on time. That's why we don't put it in stores, because they might mess it up and thaw it and spoil it before you get it. So we're a direct to consumer from HaleyNutrition.com.
Love it. Love it. Okay. So when it comes to, so what it sounds like what you're saying is the gel form is better than the juice form. I mean, what's the difference there between, the aloe vera juice versus the actual gel?
Yeah, this is where we get into a little funny terminology too, because in our industry, when it's referring to aloe and you use the word juice, you're either implying that it has other ingredients such as fruit to make it like a fruit juice with aloe vera. Yeah. Or you'll see that there's aloe vera juices that are actually fruit juices with powdered aloe added in it, usually like 200 or 300 milligrams per serving, which is not a lot. Or aloe vera juice sometimes refers to whole leaf aloe vera juice, meaning it has the inner fillet and the outer leaf. So that's how juice is used in our industry. So aloe vera gel typically refers to either the in part of the plant, which is the part that we have in the bottle, or it refers to whole leaf where it was filtered to take out all of the outer leaf. The problem is the filtering process isn't very particular, and it takes a lot of the inner leaf out as well. But gel generally refers to the crystal, the fillet, the inner part of the plant, and that's where the healing is. That's where the immune benefits are. That's the part people want for their irritable bowel conditions. And
love it. And you mentioned, just a little off topic, I mean, talking organic, we mentioned that word earlier. The closer we get to raw and natural substances, the more life enhancing that are the potential benefits. I know you're a big believer in that. Can you discuss that a little bit?
Yeah, we used a word early on, antibiotics.
Yes.
And I want to expand the definition from the typical understanding that an antibiotic is something that's administered in a syringe to a patient. Because, animals are fed antibiotics. It's in their feed. It's part of their diet. And you've heard it well said that you are what you eat. But when it comes to animal foods, you are what they ate. If they are what they eat and you eat them, and their diet includes antibiotics, not so that they can be treated when they are sick, but so they can actually be mistreated. It's in their diet as a regular thing that they consume daily. But that's still a medical kind of antibiotic put into the food. What about chlorine in our water supply? Now, we drink bottled water or filtered water, but chlorine was put in the water supply as an antibiotic, an anti against biology, life. It's in there to kill microorganisms and pathogens, to prevent them from existing in the water supply. Can you imagine drinking that and it goes into your stomach and starts passing through parts of your body where this delicate microflora inside you is so important? What about, artificial flavors, artificial colors, drugs? Is it possible that we're taking medications and we're overdosing our microflora? These things are forms of antibiotics. In food, they partially hydrogenate things, not only to change the texture, but also to make it less inhabitable by microorganisms. And they put these things in there called preservatives. Most people think preservatives are to make the food last longer. That's actually not the purpose of them. That's the side effect. Preservatives are forms of against biology, antibiotics. They're in there to prevent things from being able to exist in it. But guess what? We eat those things with the antibiotics in them and we feed them to our microflora. We're not feeding us, we're feeding them. We're 80% bacteria and viruses.
Yeah.
And we are dependent on their existence and we're feeding them chemicals. What about pesticides and herbicides and fungicides? Genetically modified organisms, people think, oh, that means you got, better corn and better fruits and better vegetables. No, it means that we have things that are Roundup resistant. What does that mean? That means we can spray it with herbicide, which is a form of antibiotic that kills plants. We can spray it with those chemicals and it won't kill it because it's now resistant to the chemicals. It'll kill everything else around it. And by killing the weeds, yes, we decrease the competition. Now we grow bigger fruits and vegetables, right? Yeah. So that's how we can grow more in less space, by spraying it with antibiotics. And that is genetic modifications. The flagship GMO corn is Roundup resistant, and it also makes its own pesticide. So in the corn is, doused with herbicide and makes its own pesticide. We can't eat that stuff and expect to live.
Yeah.
Not a long, healthy life anyway.
100%. 100%.
So what's the difference between conventional and organic? Organic is a set of standards. And it's not the ultimate standards. There's even organic pesticides. There's things that are acceptable, but they're still antimicrobial. So it's not the ultimate standard in farming, but it is a set of standards that at least we know these standards are being met. When it comes to aloe vera, I'm not going to lie, it's almost all organic, even if it's not labeled organic. Aloe vera is grown in, Dominican Republic, Mexico, where in the fields they use rakes and things like that to get rid of the weeds. Not only that, they pretty much rake them up and put them on top of the plants to help protect them from the sun. There's no chemicals really used in aloe vera fields in other countries. It's just, they don't use it. And in processing, the leaves are pretty much washed with water, and, either machines or people hand fillet them and they run them through grinders. Now, at that point, what they do with it might decide whether or not it's still organic as they pasteurize it and choose what preservatives to add to it, whether or not it passes the standards. Or if they chose to use, something other than pure water to wash the leaves, they might have chemicals that they're using to clean their equipment and stuff that is not organic. But for the most part, aloe that you see, regardless of the brand name, it's one of those things. It doesn't require pesticides, herbicides, and fungicides in the fields, and animals don't eat it. It just grows and all by itself.
I totally feel you on that. I mean, I know people out there when they go to the supermarket, they see those foods that say, not fed with antibiotics, or, pasture raised. I mean, I'm always trying to go for, the most organic, the healthiest version of certain foods. And like you say, like it's suggested to everybody out there, because what they eat is what is going inside our body, and which could have negative consequences, over time. So I totally agree with you on that. And speaking of that, I mean, speaking of aloe and things like of that nature actually has remedies that are often more effective and better for your health than anything that these drugstores can offer. Can you discuss your thoughts on that?
It's a little humbling as a chiropractor. I've had times where I couldn't get results, where I had someone with a chronic inflammatory sacroiliac joint, sacroiliitis. And, no matter how good I am as a chiropractor, in her case, I just couldn't help her. And I put her on a turmeric supplement, which was anti-inflammatory. Turmeric's very anti-inflammatory,
Yes.
and for a lot of people helps decrease their pain. And for her, it was the, magic solution. And if she stops taking, her pain comes back. you know, it is potent. Now, what would the medical approach have been? Drugs.
Yeah. Drugs,
that are not good for you.
Surgery, you name it.
We gave her something that was anti-inflammatory, anti-cancer, a very potent root phytochemical food that is nutritious and helping provide things that you can use for life, for a higher life. The medical approach would have been drugs. Ginger is anti-inflammatory and can calm and upset stomach. And, there's so much benefit for each particular food. Phytochemicals, plant nutrients. We're told we should eat 5 to 10 servings of fruits and vegetables every day, and we should be getting colors from the entire spectrum. Your deep berries are going to be rich in, polyphenols and antioxidants, and your, oranges and greens are rich in carotenoids, which have benefits, including things like, lutein, which can be good for your eyes. And, there's so many nutrients in the food, and they can be used to help us with a lot of our ailments. And in their absence, we get sick. And if you don't have enough, vitamin D, you might get rickets, or if you don't have enough vitamin C, scurvy. Well, what about some of these lesser nutrients that, we haven't studied it so much, and their absence isn't so quick to show up as an illness, but over time, all of a sudden it reveals itself. So having all of these fruits and vegetables is beneficial for our health. And yes, individually, they can be used to correct health issues, problems, challenges.
Absolutely. Now, so before we finish up, Doc, I just want to pick your brain on your thoughts on, you mentioned the fruits and vegetables. The ideal, kind of to give people a little nugget to go home with today, the ideal diet that you believe people should be eating. I mean, obviously I know everybody's different, everybody's going to respond to different diets, but your ideal version of dietary intake, as well as supplements. We've talked a lot about supplements and how something like turmeric or aloe can really, really help the body. What would be the core 3 supplements or core 5 supplements that you would say, you know what, it doesn't matter what you're dealing with, I would include this in every patient's arsenal, diet and supplements? What would you say?
Well, the top of the list for me is a powdered greens supplement.
Powdered greens. Okay.
To me, that is something for everyone, because hardly anyone is getting enough fruits and vegetables. And even if they are, we have our own likings. In my home, we dehydrate apples and bananas and mushrooms. We dehydrate other things, but those are in our house all the time. And because we have a citrus press, we have lemons, oranges, and grapefruit. And my kids are always making fresh squeezed juice. But we don't have a lot of blueberries and we don't have the kale and all the dark green. We're not having as much of that. So we're not getting necessarily the full spectrum. And most of these powdered green supplements have, 50 different fruits and vegetables in them, representing all the colors. And I prefer scoops over capsules. The capsules are great if you're not going to take the scoops because you don't like it, because you're still getting it in there. But you can get a lot more in a scoop if you can just stir it in your glass of water. And most people with a whole scoop of greens will even feel a difference. They'll have more energy at the end of the day. They won't crash so soon. That's my number one.
Okay.
If I were to go with a 2 and a 3, I'm going to say everyone is different. And I've seen huge differences for people when it comes to digestion with digestive enzymes. Inflammatory bowel conditions respond tremendously well to aloe vera. It really depends on what, your challenge is and what you're not getting enough of and what you need and what you want to accomplish. When it comes to aloe, I like telling people, drink a whole glass of aloe vera every day for a week and then look in the mirror. A lot of people will actually see a difference in their complexion.
Love it.
It's a very, very cool thing. As you heal your gut, it shows up in your skin. But number one, yes, my primary product that I sell is aloe vera. Okay. But I think the number one thing that if I was to say, what can help the most of the population, it's greens. I want to quickly answer one other question.
Okay.
What kind of diet do I consume? Probably not the kind that's right for everybody else here. Probably right for a lot of people. I'm a strong emphasis on fruits and vegetables, some cooked, some raw, some dehydrated. But I also consume animal foods. Tonight's, we're at the end of the week. I'll probably start my 2.5 gallon batch of yogurt. And usually it's a 2.5 gallon batch about once a week for me and my family. So we consume dairy, but mostly not right out of the carton. Usually it's cultured. There's no sugar added. We're culturing all the sugars. We're making it very easy to digest. And it seems to be kind of a superfood that's good for our guts.
A lot of healthy probiotics.
A lot of people would say, oh, you have dairies, cows are the devil, and all that stuff. Okay, you're entitled to that opinion. It happens to work very well for me and my family. When it comes to beef, grass-fed works for us, and it's not that we're eating it every night. We have small amounts. It's there because there's certain nutrients that seem to really work well for us and seem to help with digestion too. We're strong emphasis on fruits and vegetables because we're in such a toxic world, and they are doing real well at helping us detoxify. And yes, those same things will be in the animal foods if we're getting animal foods from the right sources.
Yes.
If the cows are eating grass and they're filled with nutrients instead of being fed antibiotics, we're not buying conventional beef. It's 100% grass fed.
Yeah. No, you see those, the chicken breasts, some of these cheaper brands, you're seeing them like as big as a house. I was like, what are they feeding these chickens out there? It's insane. But yeah, they're pumped up with hormones and antibiotics and all things that, we ingest when we eat that. So yeah, definitely follow the doc's suggestion. And, if you can buy organic, I know it can get a little expensive, but, at the end of the day, it's your health, right? So, just try to buy the best quality possible. But Doc, I would love to sit down with you again. I feel like we didn't even get to all the topics that we wanted to talk about, but I want to thank you for the plethora of great information that you provided us today. And I think a lot of people are going to benefit from this. Before I let you go, I wanted you to shout out your brand, your podcast, anything you want to promote out to the masses.
The Dr. Haley Show on iTunes is the podcast. HaleyNutrition.com. That's where you'll find contact information for me if you have questions about anything I said here today, or just maybe even something you think I might be able to help you with. Feel free to reach out to us through HaleyNutrition.com if you fill out the contact form and mention me. It will get forwarded to me, and I will get back to you personally.
Awesome, Doc. Thank you so much, and keep in touch. We'll talk again.
Awesome, Abs. Thanks.
Take care.